with morbidity rising from 58 to 62% among reportable diseases. So it's an increase with this, well, as much as people say, no COVID cases were confirmed. And meanwhile, I think the acute watery diarrhea declined from 42 to 35%. We also, of course, check another thing. One new AFP case was reported, and in total in 25, that was already 49 cases. A total of 1,075 suspect meningitis cases were reported between May and August. 73% were classified as viral meningitis and 27% as bacterial meningitis. And since June 2025, a total of 103 suspected Guillain-Barré syndrome cases were reported, with 11 associated deaths. Serum samples, 20 of that has been dispatched. There's an absolute lack that already raised on lab supplies related to that. I want to get back to one other point, which I think the DG pointed out about this plans for an ongoing military incursion in Gaza City. And of course, rightly was said it would be another humanitarian disaster on the existing disaster. But just to point out what it would mean for health system, for the struggling health system. Currently, 11 out of the 18, what we call partially to minimum functional hospitals, are located within Gaza City. They account for 35% of total inpatient bed capacity in the Gaza Strip and 48% of all intensive care beds in the Gaza Strip. So if that goes away, I mean, if that falls away, can you imagine even the impact on the health system and the health sector? Last point on medevac, because DG stressed this so much, and rightly so. Just to look at the figures, that close to 7,700 patients have been medevaced. Massive achievement, but more than 15,000 patients are in need. People ask me often, yeah, is the system working? Currently, there's a priority list of over 8,000 patients ready. So more than 8,000 patients are waiting to be medevaced. And the key asks are, again and again, we need many more countries to receive Gaza priority patients. We need to have the traditional referral pathway to the East Jerusalem Hospital in West Bank restored, and those hospitals also supported. And we need to support also the WHO team here. We are ready to expand the medevac and also our OSL operations, but of course, we need flexible support for that. Over to you. Thank you very much.
Thank you very much, Rick. And let me ask Dr. van Kerkhoff to add on the situation of the respiratory diseases in the region, maybe.
Yeah, thanks, Christian. So zooming out a little bit, just to add a little bit more context, and to say, you know, we're supporting to get more laboratory diagnostics in to support the country as well. But of course, these viruses are circulating. Respiratory viruses are circulating. COVID is not gone. It's not in the news anymore, but it is circulating. We are seeing increasing trends around the world for COVID circulation, but very few countries are actually reporting now. Flu is circulating as well. And if you have conditions where people are living in these horrible conditions, you have underlying conditions, you have malnutrition, you have starvation, outcomes are going to be worse. Rick outlined all of the diseases that are circulating there that are killing people, that are harming people. And of course, respiratory pathogens are there as well. So we will work and continue to support, and Nabil is sitting over here as well, to make sure that we provide additional diagnostic resources there. But of course, there are many, many immediate needs of the people of Gaza. But just wanted to contextualize this to state that these viruses are circulating around, and it's likely to be something that is common. But of course, we will continue to work with the country to make sure that we identify. Thank you.
Thank you very much, both, and thank you very much all. We've come to the end of our press briefing, and I thank you for your participation, especially also Professor Goyna, the chair of the MPOX Emergency Committee. We'll be sending the audio files and Dr. Tedros' remarks soon after this briefing. And then for any follow-up questions, please come to us at mediainquiries at who.int. Now, let me see. Let me give to Dr. or Professor Goyna if he wants to add a few closing remarks from his side.
Yeah. Thank you very much. I think just to say, I appreciate once again the WHO DG and his team for the work that's been done. As everybody has emphasized, we have competing health challenges across the globe, Mpox being one of them. And it's very important that we work collaboratively and collectively to ensure we address our public health challenges, including the challenge of Mpox. Thank you very much for the opportunity.
Thank you very much, Professor. And before we give now to Dr. Tedros for the closing remarks, let me ask our Director of Communications, Gabi Stern, to share a summary of her last years with us here. Thank you very much.
Thank you, Christian. Thank you, Dr. Tedros. Thanks to everyone for what you said about me today. And it really should be said about the communications staff at WHO in countries, regions, here at headquarters, but also our brilliant technical colleagues who have done massive communications over the years, including during the COVID pandemic, which obviously was a historic and also terribly difficult period for the world. I just wanted to say thanks to reporters online. I was one of you for many decades. In many ways, I'm still one of you. I think once you're a journalist, you're always a journalist. And I thank you for your coverage of all the health issues of WHO. And I encourage you to continue being fierce and telling the truth. We need you more than ever. So thank you, and back to you, Christian.
Thank you very much, Gabi. Now, over to Dr. Tedros.
Thank you, Gabi. Again, all the very best. You're an amazing human being, and we will miss you. But once WHO, always WHO. That you should know. Then to the members of press, thank you for joining us today, and see you next time.
Recording stopped.